Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Renal calculi. So the peak incidence of renal calculi is around 20 to 40 years. That is, most commonly renal calculi are associated with the age group of 20 to 40 years. They are most commonly seen in the males. And infectious stones, actually they are more commonly seen in the males. And the infectious stones, if you see, these infectious stones are more common in the females. Why are infectious stones more common in the females? Because infectious stones, that is the stones infections, that is urinary tract infections, are more common in females. So infectious stones are also more common in females. For formation of stones, for formation of any stones, we require a period of abnormal crystalluria is seen. Why is this period of abnormal crystalluria is required? This abnormal crystalluria means, first and foremost, in the urine, whenever there is high concentration of the substance, okay, this high concentration of the substance in the urine will lead to supersaturation. So this supersaturated salt will come together, and slowly there is a period of crystalluria will occur, and finally the crystal or stone is formed. So urine must be super saturated. First it should be super saturated with the salt to form the crystal formation. So for crystal formation, the urine should be super saturated.
thank you and thank you for watching.